If you're feeling like your team is running on fumes, drowning in inefficiencies, and barely keeping up with the daily demands of patient care, you're not alone. The challenge of balancing efficiency with staff well-being is real. But here's the thing. Optimizing workflows isn't just about working faster, it's about working smarter. A well-run practice doesn't just happen, it's designed. And when workflows are neglected, the damage is real. Burned out employees, frustrated patients, lost revenue, and a practice that feels chaotic instead of controlled. Welcome to Medical Money Matters, the podcast where you can find experts, answers, and resources so that you can achieve mastery over the financial and business aspects of your practice. Hello, everyone. I'm your host, Jill Arena. I began my career in accounting and finance, and I have more than 30 years of experience running medical groups. I own and operate a national healthcare consulting and revenue cycle company, and I am the author of Physician Heal Thy Financial Self. In 2020, I co-founded the Physician Leadership Project, and my passion is to increase financial and business literacy for physicians. Episode 115, Efficient or Exhausted? Optimizing Staff Workflows Without Burnout. Welcome to another episode of Medical Money Matters. If you're feeling like your team is running on fumes, drowning in inefficiencies, and barely keeping up with the daily demands of patient care, you're not alone. The challenge of balancing efficiency with staff well-being is real. But here's the thing. Optimizing workflows isn't just about working faster, it's about working smarter. A well-run practice doesn't just happen, it's designed. And when workflows are neglected, the damage is real. Burned out employees, frustrated patients, lost revenue, and a practice that feels chaotic instead of controlled. Too often, physicians and administrators assume that inefficiencies are just part of the job, or that fixing them will take more effort than just pushing through. But the truth is, inefficient workflows are costing your practice, financially, emotionally, and operationally. The good news? It doesn't have to be this way. In today's episode, we're breaking down why poorly designed workflows are tolerated when they should be completely rethought. We'll dive into the hidden costs of inefficiency, the impact on patient care and staff morale, and most importantly, the solutions, because you can design a practice that runs smoothly without running your team into the ground. Let's start with a reality check. How much is your practice losing to inefficiency? Poor workflows don't just create minor annoyances. They have a ripple effect, impacting everything from team morale to revenue collection to patient retention. When staff are constantly overwhelmed with redundant tasks, excessive administrative work, and unclear processes, burnout follows. It's one of the biggest reasons medical practices struggle with turnover. And turnover is expensive. Think about it. Every time you lose a staff member, you're paying the price in recruiting costs, lost productivity, and the stress of training someone new. And if your practice has a revolving door of employees, patient experience takes a hit too. Speaking of patients, let's not forget the cost of inefficiency on them. Long wait times, rushed appointments, difficulty getting through to your office, all of these frustrations drive patients away. And as we discussed in our last episode, in an age where online reviews shape reputations, no practice can afford to ignore this. Then there's the financial impact. Inefficiencies in documentation, coding, and billing lead to denied claims, delayed payments, and even lost revenue. The American Medical Association estimates that billing errors alone cost the U.S. healthcare system billions of dollars every year. When simple process improvements could prevent that, why tolerate inefficiency? The reality is, inefficiencies don't fix themselves, and yet so many medical practices simply accept them. But why? One of the biggest reasons is that physicians aren't trained to think in terms of process improvement. Medical school and residency prepare doctors to diagnose and treat patients, not to analyze operational bottlenecks or design workflow systems. It's not that physicians don't care about efficiency, it's that they're not naturally equipped to fix broken processes. So instead of redesigning workflows, what happens? Teams create workarounds. Maybe you've seen this in your practice. A nurse manually tracks prior authorization requests on sticky notes because the EMR process is too cumbersome. The front desk staff has a secret overflow schedule because the official one isn't working. The billing team has extra steps in their process to compensate for frequent denials. These aren't solutions, they're symptoms of a broken system. And what's worse, workarounds tend to make things more complicated over time. They might seem like quick fixes, but they pile up, adding layers of unnecessary work that drain energy and resources. The workarounds get workarounds of their own, and it goes from there. This is where leadership has to step in, because not addressing inefficiencies isn't just frustrating, it's costly. But here's the good news. Improving workflows doesn't have to be overwhelming. In fact, one of the most effective ways to fix inefficiencies is through small, intentional changes over time. This is where a continuous quality improvement, or CQI, mindset comes in. You're listening to Medical Money Matters, a weekly podcast brought to you by Healthy Practices, a healthcare consulting and revenue cycle company dedicated to keeping our clients independent. Please reach out if we can do anything at all to support your practice. You can find more information online at healtheps.com. That's www.healtheps.com. Please follow or subscribe to get all future episodes downloaded as soon as they're released. As we reviewed in episode 91, a CQI approach recognizes that workflows should evolve. Instead of treating efficiency as a one-time project, the best practices build a culture where process improvement is ongoing. And the best tool for this? The PDSA cycle. Plan, do, study, act. Here's how it works. First, plan. Identify one specific inefficiency that needs improvement. This could be anything from long patient check-in times to slow insurance claim processing. Define the problem clearly. Next, do. Implement a small change, something manageable. Maybe it's introducing a digital check-in system or revising the documentation workflow for greater accuracy. Then, after a reasonable time has passed, study. Analyze the results. Did the change reduce errors? Did it speed up the process? Did staff find it helpful? Finally, act. Based on what you learn, adjust and refine the process. If it worked, make it the new standard. If not, tweak it and try it again. This cycle is simple but powerful, and when embedded into a practice's culture, it ensures that inefficiencies don't get ignored, they get fixed. But who actually drives this kind of change? That's where a CQI team comes in. Every practice, no matter the size, benefits from having a designated team that meets regularly to review and refine workflows. This doesn't have to be complicated, just a small group of key staff members who look at what's working, what's not working, and what needs to change. A CQI team should include a mix of perspectives: physicians, administrators, nurses, billing staff, because workflow problems impact everyone. And by bringing different viewpoints together, practices can create real solutions, not just top-down mandates that don't consider daily operations. Another key component: allocating time for workflow review. This might feel counterintuitive. Who has extra time to sit in meetings about process improvement? But here's the thing. Taking time to fix inefficiencies saves exponentially more time down the road. It's an investment. Think of it this way. How many hours are wasted every week on redundant paperwork, fixing errors, chasing down approvals, or dealing with patient complaints about long wait times? If those hours were redirected towards streamlining workflows, the practice would gain efficiency instead of constantly putting out fires. And once processes are improved, document them. Having standard operating procedures, or SOPs, ensures that workflows stay efficient even when there's staff turnover. SOPs help onboard new employees faster, keep teams aligned, and prevent inefficiencies from creeping back in. At the end of the day, optimizing workflows isn't just about making life easier, it's about creating a practice that runs well. One where staff aren't constantly scrambling, where patients feel cared for, and where financial health improves because revenue isn't lost to inefficiencies. And the best part? It doesn't take a massive overhaul to see results. Small, consistent improvements, driven by a culture of CQI, create lasting change. So, where should you start? Step 1. Identify one area in your practice that feels inefficient. Maybe it's patient check-in. Maybe it's claims submissions. Maybe it's provider documentation. Pause for a moment and think about what you'd like to focus on. Step 2. Gather input from the team. What's slowing things down? Where are the bottlenecks? Step 3. Start small. Make one change. Test it. Measure the results. Step 4. Keep improving. Make process review a regular part of your practice culture. The reality is, you can build a practice that runs smoothly without running your team into the ground. It starts with recognizing inefficiencies, challenging the status quo, and committing to continuous quality improvement. Efficiency isn't about working harder, it's about creating systems that work for you, and that's something every medical practice can achieve. Thanks for tuning in to Medical Money Matters. If you found today's episode helpful, be sure to share it with your team and with a colleague who might find it helpful also. And if you're ready to take the next step in optimizing your practice, start that conversation today. At Healthy Practices, we're always up for a good CQI conversation too, so please reach out if we can be of any help. Until next time, here's to working smarter, not harder. Thanks for tuning in to today's episode of the Medical Money Matters podcast. Before you go, let me ask you, are you ready to take your medical group's coding to the next level? Because that's where Code Mastery comes in. Code Mastery isn't just another coding program. It's the ultimate physician-to-physician training solution to maximize your revenue and empower your physicians with the skills they need to code confidently and win the coding game. From comprehensive high-octane training to actionable insights, Code Mastery gives you the edge you've been looking for. Don't leave money on the table. Visit healtheps.com/codemastery to learn more and take control of your coding today. Let's transform your practice's financial future starting now. See you next time on the Medical Money Matters podcast.